My name is Amy Nolan. I'm Director of Clinical Affairs at the Irish Cancer Society, and I'm really excited today to host this webinar with the research team, with Damir and with Margaret. Today is Global Lobular Breast Cancer Awareness Day, October 15th, and it is the first one. So we're really excited to mark this occasion. Invasive lobular breast cancer starts in the cells that make up the lobules at the end of milk ducts in the breast, and it is more common in women aged 45 to 55, but it can affect women of any age. If somebody has an invasive lobular breast cancer, you might have a slightly higher chance of getting it in the other breast. So it is possible to have invasive lobular breast cancer in both breasts at the same time. A key message here today is that, and I think Margaret will also say this, that it is not always a lump. And that is something that we tend to say when we're talking about breast cancer awareness, to feel for lumps, but this does not appear as a lump. So there are many treatments for lobular breast cancer, mainly surgery initially, and then other types of treatments like radiotherapy, chemotherapy, hormone therapy, or targeted therapies can be required after that. So today we are delighted to welcome Damir Varešlija. He's a principal investigator at the School of Pharmacy and Biomolecular Sciences at RCSI, University of Medicine and Health Sciences, and co-founder and CTO of ProbeMet, a company dedicated to precision oncology therapeutics with a specialized focus on breast cancer metastases. Thank you, Damir. And also, we are joined by Margaret Walsh. Margaret was diagnosed with lobular breast cancer last year while also trying to deal with her daughter Sinead's cancer diagnosis. So they both represented our Irish Cancer Society Daffodil Day last year, for which we are very grateful. But Margaret now wishes to create awareness of lobular breast cancer for women in Ireland, and we are very grateful to her today for her contribution. So I'll ask maybe Damir if you could start today,
Perfect.
and that'd be great. Thank you.
Yeah, I'll share some slides. So I thought it might be a good idea to give a bit of an overview of what lobular is, what we know about it, and how different is it to the usual invasive ductal breast cancer that is the most prevalent.
Thank you.
So Amy's given me a very nice introduction. I am primarily a breast cancer researcher interested in metastatic disease or secondary disease. So this is basically uh, studying why certain breast cancers relapse, and once they relapse, when they spread, how we can better understand that and prevent it. This is just my conflict of interest. I think it's been mentioned, but none of it is really. I'm none of what I present today is related to my involvement with ProMed. So if we look at breast cancer and what breast cancer is, it starts off whenever you have cells in the breast that grow in an uncontrolled way. And this can happen both in different parts. It can happen in different parts of the breast. It can happen in ducts, and this is the most common type of breast cancer. Which is typically invasive ductal carcinoma, or it can start in the lobule. So this is the milk producing gland, as Amy has mentioned. And different types of breast cancer can have different symptoms and different treatments. And just like any other cancer, if you do not treat it, it has the potential to spread to other parts of the body. So if you were to compare what typically a lobular breast cancer is, if you look at the image on the left versus ductal, typically the main difference is related to how the cancers actually form tumors in the breast. So the normal ductal carcinoma, if you look at it over on the right-hand side, they typically clump together in these masses or lumps. So that's why it's much easier to detect. Whereas if you look at the lobular, they typically tend to grow in the single file formation. So they're much smaller and much harder to actually feel or detect. And a lot of this feature is down to this protein called E-cadherin. And E-cadherin is essentially this cellular glue that helps the cells attach to each other and form these masses. About 95% of lobular breast cancers actually do not have this protein. So they have either a mutation or just the protein is not expressed. And because it's not expressed, the cells don't have the ability to sort of clump together. And this is why they tend to grow in these sort of single file formation. So if you were to take away anything today, it would be the fact that they're the two major differences between the ductal and the lobular, and it's all down to this one protein called ecadherin. If we look at breast cancer itself as a whole, there are three kind of critical criteria that you would look at, and this is in terms of some of the markers that are typically tested on biopsies by the pathologist and the treating team. 70% of breast cancers tend to be hormone receptor positive. This means that they either express estrogen receptor or progesterone receptor. And in this case, hormones typically act as fuel for cells, for cancer cells to grow. And they have the best prognosis, and you can essentially treat it by cutting off the hormone supply. About 15% of them tend to be HER2 positive. And in this case, the growth factors feed tumor cells. And the way this is treated is by blocking the signaling with some of the drugs that you might have heard of, like Herceptin and all the new sort of HER2 targeted therapies that are being developed. And finally, about 15% are triple negative breast cancers, and they're actually named for what they don't have. So they don't have the hormone receptors and they don't have the HER2 positive receptors. And they typically can't be treated either with the endocrine therapy, or they can't be treated with the anti-growth therapy. And they typically tend to have the worst prognosis. One thing that sort of separates lobular to ductal is the fact that 95% of lobular breast cancers tend to be hormone receptor positive. So the vast majority of lobulars are hormone receptor positive. So they tend to be very hormone responsive and and they tend to actually respond quite well to hormone deprivation therapies. If you look at lobular, we always talk about lobular as being sort of a little subset of breast cancer. So they do represent about 15% of all breast cancers. But if you were to look at, and this is data from the NCRI registry, if you were to look at lobular in respect of all invasive cancers in women in Ireland, so this is taken away, this takes away melanoma, but if you look at, for example, breast, lung, colorectal, and uterine lymphomas, lobular, if you were to sort of look at it as its own separate entity, ranks as the 6th most common invasive cancer in women in Ireland. So this is a very sort of big proportion, a very high ranking for something that's considered sort of, rare, for lack of a better word. But because of this, it tends to be quite understudied, and it's often grouped with ductal breast cancer. So a lot of the researchers and a lot of the advocates are really trying to sort of push for this awareness and recognition of lobular as being a very important and emerging problem that needs to actually be given its own sort of research and its own clinical considerations. So if you look at the typical sort of diagnosis of how breast cancer is diagnosed, it can either be physical exam, whether you yourself or the doctor checks for changes or lumps. If you're thinking of imaging tests like your mammograms, ultrasounds, MRIs, or if you think of biopsies, where the small sample of tissue is taken to check for cancer cells. When you're talking about lobular breast cancer, the lobular breast cancer itself doesn't normally form a lump, so it's much harder to detect it by touch. Because I've already mentioned they grow in these little sheet sort of single file patterns, it makes it much more less visible on standard mammograms. The MRI can be a bit more sensitive, but it's not always used as a first test. So typically this is why a lot of cases it might actually end up being diagnosed at a bit of a later stage. And again, because of this sheet-like pattern of growth and the single file pattern, it's not as simple to take a biopsy, so it requires this sort of targeted tissue sampling, which sometimes you could potentially miss affected areas because of this diffuse growth pattern where it just grows in these little isolated single 5' So this is an issue when it comes to diagnosis, and which Amy has alluded to already. When it comes to treatment as well, Amy's kind of given a nice introduction to that. We have the surgery, so we want to remove the cancer from the breast. We have radiation therapy, where high energy rays target and destroy cancer cells by damaging the DNA of cancer cells, but also all the DNA of the surrounding tissue. We have hormone therapy, which will block the hormones that actually give the cancer fuel to grow. And then we also have chemo, which is kind of similar to radiation, typically involves DNA damaging agents that will kill cancer cells throughout the body, but then again, it will kill any other fast-growing cells as well. And what's the consideration when you're talking about lobular in this context? Well, again, surgery is challenging because you cannot remove the mass entirely, because it's not really a mass, so it tends to spread in these thin layers rather than forming a distinct lump. So typically, when the tumor is being removed, they have to use very wide margins to make sure that all the cancer is removed. And again, typically there tends to be involvement of the contralateral breast, which means then the other breast as well typically has to be looked at in that context. The radiation is effective, but because lobular breast cancers can involve multiple areas of the breast, it's very hard to do targeted or precise targeting, so it can be a little bit more complicated. And typically, what's been found is that lobular tends to be a bit less sensitive to chemotherapy compared to other breast cancer types, and this is because it tends to have slow-growing cells. But because 95% of it is hormone receptor positive, the hormone-based treatments actually may be a bit more effective in some cases. So there's a lot of kind of cons and some pros when it comes to lobular compared to other non-lobular breast cancer types. And what do we know and what do we do to sort of better understand lobular breast cancer? Well, from a clinical point of view, and this has been noted for a very long time, is that, typically they are diagnosed at older age. It typically tends to be larger primary tumors that tend to be a bit more advanced because of its later diagnosis. They tend to be hormone receptor positive. And what they found as well is that for those that actually do not respond to treatment, so those where the treatment has failed, and we get relapses, whether it's local or distant secondary spread, they tend to be very late for lobular compared to some of the ductal. So they can be, many, many years after the initial diagnosis. And the way the scientists and researchers, clinicians have all been studying lobulars by actually using donated tissue from patients, both lobular and ductal, to try and sort of figure out what are some of the key features apart from some of these, basic clinical ones that we're looking at. And what we know from these studies, and I'll try and kind of give you a brief sort of a summary whistle-stop tour, is that we know that lobular breast cancer can actually spread to places that other breast cancers don't commonly go to, such as ovaries, so the urogenital system, also the gastrointestinal tract, which includes the peritoneum, which is your lining of the abdomen. So lobular tends to spread there, whereas ductals rarely go there. And in terms of the biology, lobular again tends to be quite unique. And they do have increased sort of growth factor signaling, meaning that they do receive and respond to growth signals differently to other breast cancer cells. So there's additional things that fuel cancer cell growth. In terms of the actual growth factor signaling, lobular breast cancers actually have increased growth signals, but this also means that they have metabolic and immune changes. So these unique changes in their metabolism can actually influence how the immune system actually deals with the tumors themselves. But this is also a good thing because it could potentially offer targets for future treatments. As most of you have been, most of you are aware of the immunotherapy that's kind of being used more broadly and widely in lots of different cancers. So I think lobular might actually have a higher chance to respond to it compared to some of the other types of breast cancer because of this altered immune system. And if you were to kind of take a look at all of the sort of key changes that we know when it comes to ecadherin, or when it comes to lobular versus ductal, This is one slide that I would sort of like you to take away from this. It's really that we have an ecadherin loss, so this is that key protein. So the cells are less sticky and more spread out. And because of this, the effect is that it's harder to diagnose it clearly, and it often means that the breast conserving surgeries are not always possible because you want to make sure you get the widest margins possible. Most lobulars tend to be hormone receptor positive, and they tend to have low Ki67. And what this means is that they grow slowly. It's essentially Ki67 is a marker of cancer cell growth. So lobulars tend to be hormone receptor positive almost universally, and they grow slow. Because of this, they respond well to hormone or endocrine deprivation or hormone deprivation therapy, or what we call endocrine therapy, but they don't actually respond as well to chemotherapy. So this actually means that typically uh, lobulars don't tend to be involved in neoadjuvant studies. And this is where chemotherapy is sometimes used prior to surgery to try and actually kill as much of the cancer cells as possible. Lobulars aren't suitable for this because of the fact that they don't tend to respond as well to chemo. And from some of the sort of DNA sequencing studies that have been done, uh, there's a number of different or unique DNA mutations in these genes. I won't go into what these genes do necessarily, but lobular cancers have changes or mutations in these genes. Genes that I don't know if you've ever heard of them, AKT, P10. And what these genes do is they can actually impact how hormones and how estrogen actually drives the lobular cancer growth. So what that might mean for treatment is that instead of just blocking estrogen, treatments that actually reduce estrogen production may work better in lobular. So this is an area of sort of ongoing research. And also the fact that we have these changes or mutations in some of these genes, it means that there's maybe some new potential targets for treating hormone resistance. So meaning in a certain percentage of patients who eventually might stop responding to treatment, uh, we might have alternative modes of targeting those resistant cells. And this is a huge area of research in breast cancer in general, but more specifically, we're looking for these unique changes in the lobular. And I'll finally kind of leave you with in terms of, lobular is very different to your normal breast cancer. It doesn't quite fit the mold of when we talk about breast cancer in general, because it is quite different to the ductal breast cancers. It only might represent 15% of all breast cancer, but when you take those numbers as absolute, it's about sixth most common invasive breast cancer or sixth most common cancer in women. And there are lots of different researchers that are focusing their whole research programs on lobular. So if you're interested in following the latest updates, the latest the newest research, the newest treatment suggestions, I would seriously recommend following some of these researchers that I've highlighted here, and of course Siobhan as well from Lobular Ireland, who's very much a passionate advocate for trying to get people talking about lobular more and trying to get more research happening in this space. And then obviously we have our Lobular Ireland website, and I would also strongly suggest you go onto lobularbreastcancer.org website, where there's amazing resources that probably explain and describe this much more eloquently than I ever could. But I mean, I think I'll leave it with that, and I would really like to share that these are the people. If you're on Twitter or on X, these are the people to follow to know the latest in terms of what is happening with lobular. So thank you. I don't know if we're going to do questions after Margaret,
Thanks,
or
Damir.
yeah, thank you.
Yeah, I think that's a good idea, Damir. There are a few questions there. Some we may not be able to answer because it's treatment specific, but
Okay.
we will do our best. If it's all right with you, Damir, we might
Yeah, whatever
move
way you
to
want to run
Margaret
it.
and
Yeah,
then we'll
yeah.
we'll come back with some questions if that's okay. Thank you very much. And maybe just to say that we can share those resources with people as well online because I think that's really valuable. Thanks so much, Damir. Really interesting. Now, Margaret Walsh, thank you so much for joining us today. And some of our viewers may be familiar with your cancer experience from this year's Daffodil Day campaign. But for those hearing you for the first time, can you briefly tell us about your own cancer journey, please, Margaret?
I can. Hello, everybody. In June of 2022, our 13-year-old daughter was diagnosed with leukemia. She's the youngest of our four children, and we were spending a lot of time up in Crumlin that summer as she was so ill. But then in December, I noticed a whitehead spot on my left breast. My GP drained it as I hadn't time to get it checked out because we were up and down to Dublin the whole time. The following February, I had a mammogram, an ultrasound, and a biopsy. And a week later, I'll just say the mammogram, the ultrasound, they came back clear on the day, and I went home to wait for the biopsy results. But a week later, I was called back to Galway as something had been detected on the biopsy. So following two lumpectomies and an MRI, I went on to be diagnosed with pleomorphic lobular carcinoma in situ. I was told I would need to undergo a mastectomy on my left breast, and that I was very high risk on my right breast and would need 6 monthly checkups. So I made the decision that I wanted to have a double mastectomy, as I did not want to be constantly worrying about cancer.
Mm.
I subsequently had the double mastectomy, and when they examined the breast tissue, they discovered a 27 mm invasive lobular carcinoma, which was grade 2, and it hadn't showed up on any scans. The onco test was carried out in the tumour, which established that I didn't need chemo radiation, but as it's estrogen positive, I'm now on inhibitor treatment for the next 5 years to prevent an occurrence. Throughout all this, Sinead was still receiving daily treatment at home for her leukemia, and we're travelling to Crumlin every 4 weeks for additional chemotherapy. It was very stressful 2.5 years for us all, and my husband has been full-time on the road between Sinead and myself. But thankfully, Sinead rang the bell there the 27th of September, which signified the end of her treatment. So it's great.
That's fantastic. That's absolutely fantastic, Margaret, but phenomenal to have to go through that for the two of you. And interesting what you mentioned there about the biopsy, which kind of refers back to what Damir was saying earlier, because of the way the lobular breast cancer presents, it can be difficult to actually identify.
Yeah, very
Yeah.
much so. I got an awful shock when they called me back in.
Absolutely. I don't want to dwell on it too much, but before we get into discussing lobular breast cancer, which is why we're here today, can you just tell us about the impact of dealing with two cancer diagnoses in one household on your family and the support that you've received to get you through that?
Well, I suppose, as anyone can tell you, one cancer diagnosis in any house is hard on
Mm,
a family, both emotionally and financially. But for us to receive two diagnoses in 10 months it was heartbreaking.
mm,
My husband and I were busy focusing on getting our daughter better and concentrating on our other three children as well. So my husband had to give up his job to become a full-time carer when Sinead was diagnosed. My diagnosis came from complete left field, no symptoms. So that was a tough period for us all. We were in Dublin nearly on a full-time basis, but yet the bills had to be paid at home. The Irish Cancer Society stepped in immediately in June of 2022, offering us financial support to get us through the initial tough period, and it gave us time to collect ourselves and figure out a way forward. And we have since accessed your counselling services, therapy, and family camps.
That's great to hear that support has been there as well for Sinead and for yourself, Margaret.
Yeah,
But I think what you've described there, really the financial toxicity as well as the psychological, emotional toxicities that occur when anybody is diagnosed with cancer. It's profound.
yeah,
And I think it's great to hear that, that you've used counselling services at a time that was appropriate to you
yeah,
as well. So it's really important to do that.
yeah.
So, turning to today's topic, the Irish Cancer Society, we're a national cancer charity looking at cancers across the spectrum, and we raise as much awareness as we can all year round. We also run awareness campaigns during the different awareness months and on awareness days. And we're doing this webinar today to mark Global Lobular Breast Cancer Awareness Day. And for you, Margaret, why is it so important for us to raise awareness of this particular breast cancer?
Well, personally, I had never heard of lobular breast cancer before my diagnosis. I had no lump, I had no rash, and I had no change in my breast. I had a whitehead spot, which turned out to be just a whitehead spot.
Mm,
My mammogram and ultrasound were clear on the day that I went for tests. I was lucky that I saw a consultant who carried out a triple assessment as a matter of course. It's not
mm,
available to a lot of women, I'm afraid, in Ireland. Following my biopsy that day, I left the hospital in the false belief that everything was fine. And It was only a week later when they rang me back that I realised there was an issue, and as it turns out, they found a 27 millimetre tumour. Now, when I met with my oncologist then in May, he just said to me straight out, he says, "You know how lucky you are that I was caught so early?" And I said, "Yeah." He says, "Do you realise really how lucky you are?" He says that he never saw women with my type of lobular cancer in the early stages. He said another year would have seen an entirely different outcome. And he said he says quite possibly you could have been a statistic. So I left that day knowing I was very lucky, but I was very angry because how many people aren't as lucky as what I was. So since my diagnosis, I've discovered that 40% of women have dense breast tissue, and it shows up as white on scans, but cancer also shows up as white on scans. And this makes it extremely difficult to diagnose cancer as a result. The efficacy of mammograms to detect lobular breast cancer in dense breasts is only 11%, and women need to be aware of these facts when they're going for their tests. It is widely acknowledged that lobular cancer accounts for up to 15% of all breast cancer diagnoses, and that's approximately 400 women every year in Ireland. 30% of lobular cancers are missed on mammograms in generals, and 89% of lobular cancers are missed on mammograms on dense breasts. And these are official statistics from the ILC symposiums. I mean, breast cancer was breast cancer to me. I didn't know there were subgroups such as lobular or ductal breast cancer. These need to be acknowledged and referenced by cancer charities and organisations to raise awareness. Lobular Ireland, which was established by Siobhan Freeney, have made 2 submissions to the National Screening Advisory Committee for dense breast tissue reporting, and we are 100% committed to this because lobular breast cancer is so frequently missed on mammograms. It's called, and we have a petition going at the moment as well with Lobular Ireland calling for standardised breast density reporting for all women when they have a mammogram. Women need to be aware of the risk of lobular breast cancer and how it can remain undetected until it is too late.
Thank you. That's really fantastic, Margaret. And if people want to access those particular petitions or information around dense breast, where do they do that?
If they go on to the Facebook page Lobular Ireland or Instagram, they'll see it there.
Okay.
And they can sign the petition, and there is more information on the social media sites.
That's good to know. So we know that lobular breast cancer is the second most common type of breast cancer in Ireland, and it affects 1 in 10 breast cancer patients. And Damir explained that to us very clearly as well. What are the specific actions or supports lobular patients are calling for during and post-treatment?
There are a number of specific actions and supports that lobular patients are calling for. Women who have received a diagnosis of lobular cancer should have a follow-up MRI, and many studies have shown that the tumour extent is more accurately determined when using an MRI image compared to mammogram or an ultrasound. Also, medical cards should be awarded to all breast cancer patients. Some patients, like myself, have to take inhibitor medication in order to reduce the estrogen being produced in our bodies. And this can cause more financial stress in a household where a patient is not able to work. Support should also be given towards the cost of prosthesis and mastectomy wear for women who don't have medical cards. Many women need physiotherapy after surgery, which again they have to pay for privately. And finally, all I'll say is we urgently need funding allocated for specific research for lobular breast cancer in Ireland.
Okay, that's really good to hear as well. I think what you've just prosthetics, these are like the really practical elements of a cancer diagnosis that women have to deal with. So your prosthetics, your physiotherapy, all of those things that aren't necessarily included within your treatment plan or your treatment when you're discharged. So for anybody to access, if somebody wants to access physiotherapy, how do they do that? Do they can you get it through your hospital?
I can go through my local hospital or my GP referral, but then that's more money. I just do it privately myself.
So you do it privately yourself as well, an additional cost. Yeah, I mean, I think again that highlights the financial toxicities that are there, and even just wrangling to try and get a specific appointment that should be part of your treatment plan. I think it really highlights that as well, Margaret. So thank you for highlighting that. For women listening to this webinar today, I think the fact that one of the things we try to say to people is, look for a lump, get familiar with your breasts, how they feel. Is there anything there that you think you could have done differently?
No,
No.
nothing.
So,
And when my surgeon came in afterwards to tell me that they'd found a 27 millimeter tumor, and I said it showed up on nothing, and he said,
yeah.
yeah, it was literally, he said, like a spider's web, and he put up his hand like that, and he says it was just spread out through it. He says, and that's why it didn't show up on anything. So
Which is really concerning. Um, I'm just going to see. I know there are a number of questions here, and Anya, I might just ask you if there's a couple of people who've put up their hands, I think, but I just can't see where that is.
Yep, give
Can
me
you?
just 1 second there.
Thank you.
If you want to go ahead and take a look at the questions
The
that are
questions,
in the
perfect.
Q&A. Yeah.
Yeah, perfect. So Siobhan Freeney has asked, Damir, do you have any suggestions to the lobular community in Ireland how to push for research funding? So that was one of the clear asks that Margaret Walsh has, and how do we do that?
I think it's very important, to try and work with funding bodies for charities to actually try and establish a ring-fenced funding that specifically focuses on lobular. And this is the case in a lot of other sort of in the States and everywhere else where they would have funding that's specifically there to fund lobular research, because that's the only way you can essentially try and grow both the capacity and then also sort of feed forward to the for next funding applications, because that's that's the key. And as the research the funding landscape is very challenging for researchers and for funders, and there's not that much going around. So I think it's important to actually try and find ways of what I don't know how you do that. Obviously, from Irish Cancer Society perspective, you would be much more familiar and better place to sort of advise on that. But I think it's important to try and establish calls that actually give funding towards specific disease. And it's kind of similar to what you would do to sort of similar calls that you have for poor outcome cancers,
Yes,
uh,
yes. Yeah.
kind of things like that. So I think that's the only way to do it. There isn't some sort of magic
Pot,
so
for
yeah,
want of a
that kind
better
of thing.
phrase. Yeah.
Yeah.
Okay. So there's another question here. Should lobular breast cancer patients avoid collagen, or certain types of collagen?
Yeah. I can answer.
Thank you, Damir. That'd be
Yeah.
great.
Yeah. I mean, I would say for most of those things, there's currently no strong evidence and all that would suggest that patients with lobular or breast cancer in general would need to avoid collagen supplements. It's really, there isn't a strong rationale to avoid collagen unless this is something that's advised by your healthcare provider based on a specific treatment protocol or concern about some sort of supplement quality. But I think there is no evidence at the moment. But I think, as always consult your oncologist if you're starting any new supplements in general during cancer treatments, because some supplements can't actually interfere with certain treatments. So it's very important to sort of communicate that with your treating team.
I think that's a really good point, Damir. And I was at a conference there 2 weeks ago where that exact thing was spoken about. So different types of maybe herbs, botanicals, or other products. There's a very good website and link with Memorial Sloan Kettering Cancer Centre who do that assessment. But you should really contact your pharmacist in your clinical setting and your oncologist to determine if there's any interactions. It's really important if you're on medication, chemotherapy medication at the moment, or immunotherapies. Okay, is there a reason to stop letrozole during radiotherapy process in Finland? Is 3 weeks.
There's typically no reason to stop letrozole. So letrozole, just so for people that might know on the call, is a hormone deprivation therapy. It essentially blocks estrogen production. So it's, rather than blocking the estrogen receptor, it blocks the estrogen production. So it starves all your cells of estrogen, of hormone, and it's typically given for postmenopausal women. and there is no need to stop letrozole during radiation because the two treatments work in very different ways, and they don't usually interfere with each other. One is a sort of a DNA damaging agent, and the other one is a hormone deprivation agent. So they're not really linked. But I mean, again, any decision to pause letrozole is again made by the oncologist, and
Clinician.
it could be based on a specific treatment plan, or any maybe one consideration is a potential side effect, right?
Yeah.
But again, they will know best how different things interact, and you know, and again, your treatment plan is sort of personalized to you. So your treating doctor typically knows best in that case, I think.
Yeah, thank you, Damir. That's great. Do you know if someone is diagnosed with both ductal and lobular breast cancer? Is that classified as ductal or lobular?
So typically, this is known as a mixed type, for lack of a better word. And when a pathologist makes an assessment of what it looks like, they will typically classify it as ductal with some
Okay.
features of lobular. So it typically gives the sort of the overarching feature of it is that it's going to be classified as a mixed, but it doesn't change treatment because at the moment really people aren't necessarily treated different whether you have ductal or lobular, and I think that's probably part of some of the sort of issues that are being raised by advocates and people that actually want to highlight the need for a more tailored approach, but they do exist. I think that it's the short answer.
Okay. Thanks, Damir. Then it's a comprehensive kind of diagnosis is, I suppose, what people are looking for, and then what the treatment plan would be related to that. Perfect. So what would be a good way to follow lobular cancer after treatments? Because it doesn't show up in mammograms in Finland because the lack of money, a yearly mammogram is the only thing they offer right now. I think it's not enough, this person says.
Yeah. I mean, again, the MRI is probably, I mean, if you look at mammography, it's probably not the best because of that. You know, we've kind of mentioned a good bit of time. It's less visible. If you're looking at terms of combination of breast MRI, ultrasound, and general self-awareness can definitely improve follow-up care. And I think it's something that's probably being incorporated more and more. And I think if you're talking about now, just I can't see the question exactly, but
Sorry.
if you're talking about specifically after it's been detected and it's gone under treatment, which means it would be surgically removed and you would be under chemo and hormone therapy, then the sort of the classical follow-up in that context works kind of probably equally well for both ductal and lobular. It's just those sort of initial diagnostic ones. But yeah, but the
Okay.
MRI is still probably
Best in
the
class.
best in class in that instance.
Okay, that's good to know. Somebody else has asked, I think it's radiation therapy safe since it ruins the DNA of healthy cells? But I ask in this case if the radiation is given after surgery and they can't see tumor left, but plan to make radiation because of the possibility remaining cells in the left side. Yeah, I think that's the
I think
question.
that's the sort of the rationale behind most drugs, right? So
Yeah,
even when you're giving endocrine therapy, when you're giving chemo, is you're essentially trying to treat cells that you can't see or the cells that mightn't have been fully removed to prevent relapses. Now, radiation therapy is generally considered safe and effective,
yeah,
even when you use it after surgery when there's no visible tumor.
hmm
And the risk that, of course, there is a risk to heart and health and other healthy tissues, but typically this is minimized through advanced techniques. Because not right now it's very sort of precise and targeted rather than, you know, you're not giving sort of you're not giving whole body
Yes,
radiation.
radiotherapy. Yeah,
But the benefit of reducing recurrence
yes,
usually outweighs the risk of damage. And
yeah,
this is the reason why it's part of
the treatment plan.
the treatment plans.
Yeah. And I think Margaret referred to Oncotype DX, which is a new type of test that can identify if it's necessary for you to have chemotherapy, radiotherapy post your surgery. So I think that's another newish way to identify what the treatment plan should be.
Yeah.
And when I was clinically working, we used to say that radiotherapy is like belt and braces then for, on top of the original treatment that you had to prevent recurrence. So Joyce has said she just had surgery last week. Does the MRI definitely show lobular cancer? Again, back to the MRI, slightly worried about the other breast.
Yeah, and again, this is something that will come up typically once it starts going into treatment. If you've had surgery, they would typically sort of assess a lot around it. They would assess lymph node involvement, various types of things, and then based on that, they would have an idea of the risk of sort of contralateral breast. But all of these things are sort of taken into account in the sort of for the lack of a better word, the algorithm of the right treatment. And the team that's treating you would definitely sort of consider all those things. And if they felt that there was a need, they would investigate.
Okay, great.
But I mean, obviously, at a time like that, you're going to be worried. So
yes.
it's not an unfounded
worry. Yeah.
Worry. Yeah.
Absolutely. Okay, thank you, Damir. Are there any technological or scientific developments to make a mammogram more efficient so different class types of breast cancer can at least be distinguishable?
They're constantly improving these technologies in terms of detection. And I mean, the easiest thing to do is you can just even simply Google what MRIs used to look like versus what MRI looks like now in terms of the definition and what it looks like. But I think even though the mammogram machines have improved significantly, it's down to the fact of, what it's able to see. And this becomes an issue. I think I don't know, typically, I don't know if you've mentioned it yet in this, but one of the things that makes breast cancer in general difficult is sort of dense breast tissue. And if you've got dense breast tissue and then you have lobular, it's going to be extremely hard to be able to actually see anything on a mammogram. So no matter how much, they are constantly advancing it, but when it comes to lobular, I think that alternatives in terms of MRI, and those are also improving consistently. Technology is always sort of on an exponential, an exponential improvement. So there is capacity to kind of get there in the future, but it's hard to predict.
Can I say something there, please?
Yes, Margaret. Thank you.
Often a follow-up with a mammogram is not enough following a primary diagnosis with lobular cancer. And at the moment, there's a campaign to change the guidelines in the UK to include an MRI when you're going for your checkups. And I know that in America, it is now law over there since September that women have to be informed of how dense their breast tissue is, so they can be fully informed when they're going in for their checkups.
Okay. And is that part of a screening process, Margaret, or is that just they're going in for a mammogram as part of their own checkups? When they're
going in for their mammogram and their checkups, they have to be told what their density is now as well.
Okay. And do you have dense breasts, Margaret?
Yeah, I'm borderline. I'm borderline.
Okay.
Yeah.
Okay. Okay, that's good to know. Now, Bridget in Sligo Cancer Support Centre, thank you. Bridget has said that local cancer support centres can provide support as well, which is fantastic, including the emotional challenges dealing with that. And she also mentioned very helpfully that hormone treatments can sometimes have an impact on anyone who has diabetes, which is a good point to make as well. And I'm sure your clinical team would let you know about that. Another question here, if mine is lobular and appeared as a lump, HER2 positive and de novo metastatic, it's likely this anomaly is related to genetic mutations that Damir mentioned?
Yeah, I mean, it's possible that in that particular case where you might have a lobular that appears as a lump, it's also a HER2 positive. It could be linked to specific genetic mutations because HER2 positive status in lobular tends to be less common compared to like the hormone receptor positive, and the fact that it also presented as de novo metastatic sort of adds a bit to the complexity, So I think it's a case of seeing what's the sort of best course of action. But the thing with HER2 positive Breast cancers, there's a very different treatment options and very different treatment plans, and it's probably the sort of the biggest growing area in terms of cancer therapy. There's so many different drugs out there that treat HER2 positive breast cancer. So I think sometimes even having something like that is it's an additional option to actually be able to target the cancer cells. But it is a sort of a low frequency lobular breast cancer.
Okay, thank you. There's a really good question here that I think a lot of people would be interested in. What questions should lobular patients be asking at oncology checkups and yearly checkups?
So I think this is really sort of it's the best thing to do is to be informed and kind of keeping in touch with these sort of um, events that are organized. And even if you go and visit some of the websites that I've signposted, it's just knowing exactly that what you have and knowing yourself what's the best sort of you have to be your own best advocate and be able to sort of advocate for yourself. And if you know about lobular, obviously your treating doctors will also they have your best interests
Yeah,
in
at heart.
at heart, exactly. So they will do the best, but it's also good for you to also be aware, because one of the key things that I mentioned is if there was ever anything to happen in terms of you having a relapse, so this is kind of almost post-treatment, knowing that lobular actually has very sort of unique sites of secondary cancer is important, because often if you go to your GP and if you feel something, it might be a case for you to be sort of dismissed as it being something else, especially when you're talking about things like GI and those sort of weird things. But there's a really good, actually, I didn't put the website in. It is ABC Diagnosis. It's a UK website, and they do a lot of work for secondary breast cancer, and they have a specific leaflet for lobular breast cancer, sort of follow up, what to look out for in terms of signs and symptoms. And I think this is a really kind of, you could probably go and print it off,
Yeah,
download it, and kind of nearly have that with you.
yeah,
If
that's a
you
great
should ever
idea.
need it, hopefully you never need it.
Yeah,
That's plan A. But if you should ever need it, it has amazing sort of information that's super, super useful.
okay, that's fantastic. Is it harder to detect lobular cancer that has spread elsewhere due to the same reason it's hard to detect in the breast?
Same reason, because again, these cells will be more diffuse, and then they tend to grow slower. So they'll have, as I mentioned, they have this lower proliferative index. And when you start detecting sort of secondary breast cancer, you're relying on there being enough cells.
Yeah.
You're relying on there being enough of a signal to be detected. So quite often, again, uh, it can be a bit slower to come up as a secondary because it's very slow
Okay.
growing. But again, I think it's a limitation of diagnosis across all cancers. You don't really know that it's spread until it's big enough to be clinically detectable. So I mean, that's an issue with all, especially with lobular if it's a slow grower.
Okay. Thank you for that. Question there, and this probably is for you, Margaret. Are there any peer support groups in person in Ireland for people with lobular breast cancer? Would you know, Margaret?
Well, I had to go searching myself when I was
Yeah.
diagnosed. So I discovered Lobular Ireland. It was set up by Siobhan Freeney a number of years ago. There's a Facebook page and a WhatsApp group, and it supports newly diagnosed patients, and it gives huge support to people like myself and others who are trying to figure this out, because there wasn't an awful lot of information when I was diagnosed in relation to lobular cancer.
Okay, so you found that really helpful, Margaret. And
I
would you
did.
meet online or in person, or is
Mainly
there
online. We've met
mainly
in
online?
person
Yeah.
once so far. It's not
And
easy because we're all over the country.
yeah, exactly. And I'm sure that even online, and now I think we've got used to so much since COVID, people are able to have those conversations online
Yeah.
as well, which is really helpful. That's good to know. Um, so there's another question here around is the oncotype test a good? Can rely on the results since the chemotherapy doesn't work as good for lobular cancers?
Yeah, I mean, the type DX test is for anybody on the line who doesn't know,
Mm.
it's used to guide treatment decisions, particularly for hormone receptor positive, like the ones we've been discussing. So it would typically be good for hormone receptor positive, HER2 negative. And what it does is it provides a recurrence score based on the expression of 21 genes. And if depending on the level of expression of these 21 genes, it tells you the likelihood of the cancer relapse and the potential benefit for chemotherapy. It's a very useful tool, and it's been tested in both ductal and lobular. It hasn't been tested specifically for lobular separately,
Mm-hmm.
but lobulars have been included. So the initial tests and the subsequent validations did have uh, lobular cancer patients in there. So it will have the same sort of same sort of recommendation in terms of whether chemotherapy might be beneficial or not. And what it does is basically gives a low score, medium score, and high score. If you have a low score, you most likely would not benefit from chemo, whereas
Mm-hmm.
a high score means like you should have chemo, but that won't, the Oncotype DX won't tell you necessarily will you respond to chemo. That's just completely sort of
Yeah.
a separate entity. It only tells
Yeah.
you based on the expression of these genes whether you are likely to
Likely
maybe
to,
have a
yes,
relapse. So
recurrence.
yeah.
Yeah. Perfect. Thank you for that. Given given the increasing recurrence risk of lobular breast cancer, what is the recommended surveillance?
Yeah, I think it's just again, the surveillance that they do in terms of the usual
Clinical
follow-ups,
checks.
clinical checks is very important.
Mm-hmm.
And then the only thing that I would add is that people are aware of, other signs and symptoms that are specifically related to the lobular breast cancer secondary spread. So that's the important thing to consider. And again, this will not be relevant for thankfully majority of people.
Mm-hmm.
But if it's something that something to be aware yourself and to be able to flag with your GP or with whoever is actually doing your follow-up care.
Great. My goodness, there's so many questions coming in here. It's obviously very, very topical, and I'm just conscious we are coming towards the end of the meeting now. Now, Siobhan has mentioned, would the Irish Cancer Society facilitate a face-to-face meeting for lobular patients in Dublin? I think that's absolutely possible, Siobhan. We would be happy to open our doors to something like that. And let me see. Is there any other last ones? I'm really sorry that we haven't got to answer any of some of the questions. Somebody's just asked, is there CEM contrast enhanced mammograms available in Ireland yet?
To be honest with you, I couldn't be
Tell me. Yeah.
100% sure.
Yeah. Grant.
It's a sort of it's an emerging tool,
Mhm.
but I think definitely there's the availability varies country and probably region as well.
Okay.
So
And
I think it's becoming more widely adopted, but I couldn't tell you where,
okay,
who has
that's
it.
who has what exactly. And is there a limit on MRIs that one should have? The surgeon mentioned about the dangers of the contrast used.
Yeah, I mean, like with most things like that,
Radiological.
there's a certain sort of uh, benefit to risk. Same way we were talking about, probably not as obvious, let's say, as we talk about targeted
Hmm.
radiation or something like that. But most of these things should be limited and used within what is an acceptable sort of an acceptable usage for the lack of a better
Yeah, phrase.
but
Yeah.
yeah.
Thanks, Damir. There's a question there from Sandra as well. She's concerned there's no standardized medical exam treatment, but for lobular cancer, and also no support for patients with menopausal symptoms. And just to mention, we have a webinar series at the moment available on menopause symptoms for patients with cancer. So, Sandra, that might be something of interest to you that we can share as well with the group. But yeah, so then let me see. Uh, Breast cancer. So just there, Ashling, sorry, back to Ashling there. Just want to get an idea. Most lobular breast cancers in general continue treatment post 5 years. She's 38 and will be going to get advice from her oncologist. But I imagine that would be the hormone treatment over 5 years. And I know in some cases they have extended some of the hormone treatment to 10 years. But again, I think that's specific to your oncologist.
Yeah, I mean, I think again, quite often extends beyond 5 years, particularly for younger patients or those with a sort of a different risk profile. But again,
Yeah.
those decisions really are about, patient's age, menopausal status, stage, how you
Yeah.
respond to therapy and risk. So again, this is something that the oncologist would likely weigh all these different factors specific to your individual case, and then they decide whether it's
Yes.
beneficial for you to extend or not.
Perfect. And then Caroline has asked, is there a specific new drug for metastatic lobular cancer?
I wouldn't say there's a specific drug for metastatic lobular, but we're
Yeah.
constantly working on finding new drugs for metastatic disease. So, for example, I think one of the first questions that came
Yes,
up was
sorry, Vercinius. Yeah.
Fresenius, which is essentially it is a CDK4/6 inhibitor, which is essentially it's a thing that controls cell cycle. So it's a thing that controls how cells proliferate, and it's used and it is started off as a metastatic drug to treat hormone receptor positive, and it works, I think, equally well for ductal and lobular. While no studies have been done specifically for lobular, it's been shown to work for hormone receptor positive. So this drug was very successful in the metastatic setting. That's why it's kind of been moved now to like early stage to accompany hormone therapy. So a lot of drugs are kind of coming out now that are aimed at treating metastatic disease. None of them are ever created for specifically lobular, but
Yes.
eventually they get incorporated into care, and then we can find out whether they work well there. But there's a lot of things to sort of consider, both genetic profile and a whole plethora of things.
Thank you. That's great, Damir. Thank you for that. And I think we probably need to finish up now, but what I would like to say to everybody is that our cancer support line is open Monday to Friday, 9 to 5. And the number is a free phone number, 1-800-200-700. Or if you would like to email, because sometimes it depends on when it suits you to have a call or a conversation. And the email address is also there. So cancer.ie for any other information that you need. Talk to our support line nurses as well. We're always really happy to help in any aspect. So that can be with regard to like the financial toxicity, the psychological, the emotional impact of a cancer diagnosis. I'm very grateful to Damir today for his very comprehensive and really easy to understand, I would say, presentation as well, Damir, and Margaret. And I know, Margaret, you have your hand up there. Would you like to say something?
Can I just mention that Lobular Ireland have an email, lobularbreastcancerireland@gmail.com. I'll send it on to you later, Amy. Maybe you could
Great.
put it up, because email is always answered for anybody who is facing into this lobular journey it is. And just to mention again that our petition here is for density reporting for women, which I believe is very important going forward. And we appreciate the help you gave us today in raising awareness, and we're hoping that it will continue on into the future.
Thank you, Margaret. I really appreciate you sharing your story with us, because it's not easy to do that, and it's very generous of you to do that. And I think it just, as you said, it opens a conversation for many other people. And Anya will share the link for the YouTube video, and also then some of the resources that Damir has outlined and Margaret have outlined. So very grateful to everybody for attending today and for giving us your perspectives on lobular breast cancer. And I think that's a really good start to the first Global Lobular Breast Cancer Day, and really grateful to you all. Thank you all so much. Thank you.